I want to look at a subtle aspect of heart failure. It's a much more, how will I put it? It's an aspect of heart failure that is always being neglected. Okay. So this is the fact that when you have heart failure, before you had the heart failure, your body was kind of like fighting. Your heart was kind of like trying to compensate. Do you understand? As the functions were going down, there's a whole lot of mechanisms in place to kind of like fight back. So let's list them, okay? Just so you know. It could be an exam question. It could be an objective question. So what we have here is this. Before heart failure comes in, the sympathetic nervous system and the renin-angiotensin system, they are acting to maintain blood pressure and still ensuring that what blood is flowing to the various organs properly. Do you understand? Because normally that's the function of the heart. So of course, as the heart is failing, if you want it to still work properly, then you have to put in more work, right? The heart also has to put in more work and effort, you know. So because the heart wants to actually pump blood effectively, there's increased heart rate, all right? So salt and water retention by the kidneys help to preserve blood volume. There's increase in how the heart is pumping. Why? Because normally the heart could just pump slowly and deliver to the body, but right now the functions is going down, so it has to work more. All right. Selective peripheral vasoconstriction, maintenance of blood pressure. Okay, these are all the mechanisms coming in place to actually tackle the heart failure. So as the congestive cardiac failure continues, the same compensatory mechanisms cause adverse effects. Yes, because the heart is beating too much. Now it needs more food to be able to do that work. So there's increased myocardial oxygen demand. Now the heart muscles are working more than before. So it's just like I'm doing exercise in the gym. Of course, my biceps will get bigger. So the heart muscles pumping too much, they also get bigger. That's hypertrophy. Then cardiotoxicity, you have a lot of waste products being produced, could also become toxic and lead to cell death. You understand? So now the amount of blood that the heart is pushing out becomes worse. So there's low cardiac output. It leads to what? Poor blood reaching organs in the body. Do you understand? Increased venous pressure leads to lung and liver congestion. Neurohormonal activation leads to a whole lot of sodium and water retention in the body. That's what actually leads to edema. Do you understand? Do you understand? So that was it. Okay, that's how these issues come in. First of all, the factors come in to help you fight, but later on now they also lead to further complications of the heart failure.